مندوب جلالة الملك عبد الله الثاني بن الحسين المعظم، صاحبة السمو الملكي الأميرة منى الحسين المعظمة.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. شهد الله أنه لا إله إلا هو والملائكة وأولو العلم قائما بالقسط. لا إله إلا هو العزيز الحكيم. إن الدين عند الله الإسلام، وما اختلف الذين أوتوا الكتاب إلا من بعد ما جاءهم العلم بغيا بينهم، ومن يكفر بآيات الله فإن الله سريع الحساب. اقرأ باسم ربك الذي خلق، خلق الإنسان من علق. اقرأ وربك الأكرم الذي علم بالقلم، علم الإنسان ما لم يعلم. صدق الله العظيم.
صدق الله العظيم. بسم الله الرحمن الرحيم. صاحبة السمو الملكي الأميرة منى الحسين المعظمة حفظها الله، مندوبة عن صاحب الجلالة الهاشمية الملك عبد الله الثاني بن الحسين، صاحب السمو الملكي الأمير مرعد بن رعد، معالي وزير الصحة الدكتور سعد جابر الأكرم، سعادة اللورد نايجل كريسب، عطوفة اللواء شوكة التميمي، أصحاب المعالي والعطوفة والسعادة، الحضور الكرام، أهلاً وسهلاً بكم. أقف بينكم اليوم ويتبادر لذهني عدة تساؤلات. ما الذي يجمع أكثر من 600 خبير من 15 دولة للعام الخامس على التوالي؟ لماذا تحظى مبادرات الجودة والاعتمادية باهتمام ودعم سياسي على كافة المستويات؟ ما هو القاسم المشترك الذي يجمعنا في هذه القاعة من قادة ومتخذي قرار ومقدمي خدمات وإداريين؟ والجواب بكل بساطة هو التزامنا المهني والأخلاقي أفراداً ومؤسسات بأن يحظى كل مريض في أي بلد كان ومهما كانت قدرته المالية على حقه بالوصول لخدمات صحية ذات جودة. إن توفير الخدمات الصحية ذات الجودة العالية ليست فقط هدف أساسي من أهدافنا التنموية، بل هو التزام سياسي يحظى باهتمام خاص من صاحب الجلالة الملك عبد الله الثاني بن الحسين المعظم حفظه الله ورعاه، وصاحبة السمو الملكي الأميرة منى الحسين المعظمة، وأصحاب السمو الأمراء. ونحن في مجلس اعتماد المؤسسات الصحية حرصنا كل الحرص على أن نترجم رؤية صاحب الجلالة والتزامات الحكومة إلى مبادرات عملية نعمل على تحقيقها بالتعاون مع كافة الشركاء بهدف دفع عجلة الجودة في القطاع الصحي الأردني وتحقيق سلامة المريض على كافة المستويات. أصحاب السمو، الحضور الكرام، في الأردن قصة يحق لنا جميعاً أن نفخر بها وأن نقدمها للعالم، وهي قصة نجاح مجلس اعتماد المؤسسات الصحية. ولهذا أنتهز فرصة وجودكم معنا اليوم لأستذكر بعض إنجازات مجلسكم التي لم يكن لها أن تتحقق دون دعمكم ومساندتكم. كما تعلمون فقد بدأ المشوار منذ عام 2003 بحلم وطني لخلق أداة لتمكين وقياس جودة وسلامة المرضى، وفي عام 2007 تم إنشاء مجلس الاعتماد بجهود وطنية، وكان تطوير أول أداة للجودة وسلامة المريض وألا وهي معايير المستشفيات. ومع مرور الوقت نجحنا في مأسسة هذه المعايير وطورنا أكثر من 10 برامج اعتماد، واليوم نفخر بأكثر من 190 مؤسسة معتمدة من شمال الأردن إلى جنوبه. وشهدت دراسات عدة على أثر الاعتماد وأهميته، فلنشاهد معاً مخرجات إحدى هذه الدراسات.
Hcac takes a collaborative approach through standards development, consultation, accreditation, capacity building, and research. Healthcare organizations interested in improving their performance and quality of services enroll in the accreditation journey, starting with an initial assessment and internal reflection against the scientifically and internationally accepted Hcac standards. We investigated the outcomes of the Hcac process with 15 hospitals. We focused on outcomes for safety, appropriate care, and patient-centeredness. Accreditation contributed to preventing and reducing the risks of hospital-associated infections by improving the infection prevention and control practices. Accreditation has supported the provisions of comprehensive, appropriate, and timely care. In accredited hospitals, physicians reported receiving critical laboratory results faster, enabling them to take time-sensitive decisions and save lives. Accreditation protocols improved patient identification in medication administration, blood transfusion, and surgical procedures, while improvements to medical records ensures patients have a complete, confidential, and secured data history, supporting improved access and continuity of care. Hcac accreditation has influenced improvements in all areas, ensuring the provision of safer care, with facilities meeting 94% of the accreditation standards. Hcac, your partner for improving quality and patient safety.
وإن هذا التغيير وأثر نهج الاعتمادية لم يتحقق بدون تطوير كوادر ذات مهارات عالية، فقد بدأنا رحلتنا مع 20 مقيم، وها نحن اليوم نكمل مسيرتنا مع أكثر من 100 مقيم. بدأنا ب4 برامج تدريبية و30 متدرباً، واليوم يتجاوز عدد خريجي دورات المجلس 1000 متدرب. ولإيماننا أن الجودة وسلامة المريض هي ثقافة مجتمع، أطلقنا نشاطات عدة، أهمها مبادرة يوم التغيير والحملات الوطنية التي تدعو لحماية حقوق المرضى، والمسابقة الإعلامية السنوية لتفعيل دور الإعلام في هذا المجال. ولم يتوقف عمل المجلس عند الاعتماد، إذ أنه توسع وتشعب في عمله ليصبح أحد أهم المؤسسات الداعمة لسياسات التغيير والتحسين الوطنية في المجال الصحي والاجتماعي، كدعم البرنامج الأردني لسرطان الثدي أو المستشفى الصديق للطفل، ووضع المعايير التي تدعم تحسين الخدمات للأشخاص ذوي الإعاقة وتعنى بحقوقهم، وكما تدعم الفئات الأقل حظاً. صاحبة السمو، الحضور الكرام، لم يخلو أي عام من أعوام مجلس اعتماد من مبادرة جديدة تميز كل سنة عن سابقتها، ولقد كان عام 2019 عاماً حافلاً بالإنجازات، فقد تم اعتمادنا كأول مؤسسة صحية بالعالم العربي تتعاقد مع الوكالة الأمريكية للتنمية الدولية بشكل مباشر، كما فزنا بعضوية مجلس إدارة الجمعية الدولية لجودة الرعاية الصحية الإسكوا كأول مؤسسة عربية تحظى بهذا المستوى من التمثيل، ملتزمين بذلك بمسؤولية تمثيل صوت المنطقة واحتياجاتها، وتجديد العهد بأن نكون دائماً في مقدمة العاملين على تحسين جودة الخدمات الصحية على المستوى المحلي والإقليمي والعالمي. أيها الحفل الكريم، تحقيق هذه النجاحات لم يكن سهلاً أبداً، ولكن الأصعب من النجاح هو المحافظة على استمراريته وتطويره، وعلى مجلسنا أن يبتكر ويطور برامج إضافية ينتج عنها البيانات، مثل برنامج قياس تجربة المريض والذي بدأنا بتطبيقه. ومن الخطط المستقبلية استخدام هذا البرنامج في آليات تصنيف المستشفيات ودعم متخذي القرار وصانعي السياسات في استخدام البيانات والأدلة العلمية لاتخاذ القرارات. كما وسنركز أسوة بالممارسات الفضلى على إشراك المريض في كل خطوة من خطواتنا، وندعوكم من هذا المنبر لأن نتوسع في كافة برامجنا التي لها الأثر على توفير خدمات أكثر أماناً. نجتمع اليوم لهذه الأسباب ولبرنامج ثري بالمعلومات والتجارب، وليحدثنا عن هذا المؤتمر اسمحوا لي أن أدعو من هو غني عن التعريف ومن نحن ممتنون لدعمه المتواصل وتوجيهاته الحكيمة والتزامه الإنساني لتحسين الجودة وسلامة المرضى، من الرواد في إدخال مفاهيم الاعتماد الهادف لرفع مستوى خدمات الرعاية الصحية في الأردن، نائب رئيس مجلس إدارة مجلس اعتماد المؤسسات الصحية ورئيس مؤتمرنا هذا عطوفة الدكتور فوزي الحموري، فليتفضل مشكورا. الله يعافيك، الله يعافيك. ما شاء الله عليك. تسلم. ضربوا معي.
بسم الله الرحمن الرحيم، والصلاة والسلام على سيدنا محمد خاتم الأنبياء والمرسلين، صاحبة السمو الملكي الأميرة منى الحسين المعظمة، مندوبة صاحب الجلالة الملك عبد الله الثاني بن الحسين المعظم، صاحب السمو الملكي الأمير مرعد بن رائد، معالي وزير الصحة الدكتور سعد جابر، سعادة اللورد ناجل كريسب، عطوفة اللواء شوكة التميمي، أصحاب المعالي والعطوفة والسعادة، أيها الحفل الكريم، اسمحوا لي بالأصالة عن نفسي وبالنيابة عن مجلس اعتماد المؤسسات الصحية أن أتقدم إلى مقام صاحب الجلالة الملك عبد الله الثاني بن الحسين المعظم بجزيل الشكر والعرفان على رعايته للمؤتمر الخامس للجودة في الرعاية الصحية. وإن هذه الرعاية السامية لدليل واضح على اهتمام جلالته بتحسين جودة الخدمات الصحية المقدمة في المملكة لمرضانا الأردنيين والعرب والأجانب. وفي هذه الأيام لا بد لي أن أشير إلى حدث هام أسعد الأردنيين بعودة السيادة الأردنية على كامل التراب الأردني الوطني. بقرار من جلالة الملك عبد الله الثاني بإيقاف ملحق معاهدة السلام وإدخال البهجة والسرور على وجوه الأردنيين في هذا الوقت الصعب. كل الامتنان سيدتي صاحبة السمو على تشريفنا في هذا اليوم، ونحن نقدر دعمك المتواصل للقطاع الصحي بكامل مكوناته، فلا يكتفى بالمجلس التمريضي ومجلس الاعتماد وجميع المبادرات، فنجدك دائما موجودة بيننا، فشكرا ستي. والشكر موصول لمعالي الأخ الدكتور سعد جابر على إيمانه بأهمية الاعتمادية وتحسين الجودة في القطاع الصحي بجميع مكوناته، في القطاع العام وفي القطاع الخاص. وبالتأكيد زملائنا بالخدمات الطبية الملكية وفي المستشفيات الجامعية والمستشفيات الخاصة وجميع مكونات القطاع الصحي، فشكرا لكم على هذا الحضور الكبير. يعني بحب أحكي اليوم أنه هذه القاعة لم تتسع للحضور، فاضطرينا نعمل قاعة ملحقة وفيها بث مباشر من هذه القاعة، وبالتالي هذا يؤكد مدى اهتمام العاملين في القطاع الصحي وقيادات القطاع الصحي على المشاركة في هذا المؤتمر الهام. فنحن نجتمع اليوم في عمان عاصمة الطب العربي بحضور هذا الكم الكبير من المشاركين من الأردن ومن الدول العربية الشقيقة والدول الصديقة، ونلتقي في حدث هام يعتبر الأهم والأبرز على مستوى الشرق الأوسط وشمال إفريقيا. واسمحوا لي أن أرحب بضيوف الأردن من المتحدثين والخبراء والمشاركين، واسمحوا لي أذكرهم من بريطانيا ومن سويسرا والولايات المتحدة الأمريكية وإيرلندا وتركيا وماليزيا وروسيا واليابان وأن المملكة العربية السعودية والإمارات العربية المتحدة ولبنان ومصر والسودان وفلسطين وسلطنة عمان، فأهلا وسهلا بكم. صاحبة السمو الملكي، أيها الحفل الكريم، إن مجلس اعتماد المؤسسات الصحية في عامه 12 يحتفل بأنه ينجز إنجازات تم عرضها في البرزنتيشن السابق، ولكن هدفه تحسين جودة الخدمات وتعميم فكر الجودة والاعتمادية في المملكة. وتنظيم هذا المنتدى للدورة الخامسة على التوالي يؤكد التزام المجلس بهذا الهدف وضرورة ضمان تطبيق مبادئ الجودة وسلامة المرضى في جميع المرافق الصحية. واخترنا في هذا العام شعار أن يكون الاعتماد وسلامة المرضى من البداية، والمقصود بذلك أن يتم الأخذ بعين الاعتبار عند بناء المستشفى أو المركز الصحي أو حتى وضع السياسات والخطط، أن تكون سلامة المرضى والجودة والاعتمادية هي محور التخطيط الاستراتيجي الذي نقوم به. يعزز دور المجلس الوطني الرائد محليا ودوليا، والذي يحرص على تعزيز قدرات المؤسسات الصحية والعاملين فيها من خلال تزويدهم بالمعرفة والخبرات اللازمة وتشبيكهم مع الخبرات العالمية والمساهمة في دفع عجلة التطور والجودة وسلامة المرضى. لماذا؟ ليبقى الأردن في طليعة الدول في مجال الخدمات الصحية بأعلى مستويات الجودة. وقد حرصنا خلال إعداد برنامج هذا المؤتمر أن يكون جلساته غنية بالمعرفة والخبرة العلمية والعملية، فكانت محاوره تجارب الاعتمادية في تحسين الجودة وسلامة المرضى، الممارسات المدعمة بالأدلة والبيانات، أنظمة الرعاية المتمحورة حول المتلقي، رسم السياسات والتشريعات الناظمة للرعاية الآمنة، والجهود المشتركة بين مختلف التخصصات لتحقيق نتائج أفضل، لأن الجودة والاعتمادية لا تعتمد فقط على الأطباء أو المدراء أو الممرضين أو الصيادلة، جميع المهن الصحية يجب أن تشترك في ضمان جودة وسلامة المرضى. وليس ذلك فقط، فبالأمس أنهينا 6 ورش عملية شارك فيها ما يقارب 600 مشارك من مختلف القطاعات، وتحدث فيها خبراء دوليين وكان فيها مكسب علمي وعملي للمشاركين في هذه الدورات. وكانت الدورات تتمحور حول تطوير المسار المهني من خلال تعزيز المهارات القيادية والإدارية، الذكاء الاصطناعي وتطبيقاته في سلامة المرضى، وتطوير دور منظمة الصحة العالمية في تطبيق التغطية الصحية الشاملة، استخدام الإدارة الرشيقة في تحسن تدفق المرضى، والحد من عدوى العمليات الجراحية كوسيلة لضمان سلامة المرضى، وأخيراً الحوكمة السريرية والتدقيق السريري. وهنا لابد لي أن أشكر الداعمين لهذا المؤتمر، لولاهم لم يكن يستطيع مجلس اعتماد المؤسسات الصحية أن ينظم المؤتمر وأن يدعو هذا الكم من المشاركين. وعلى رأس هؤلاء شركة أدوية الحكمة الشريك الاستراتيجي لمجلس الاعتماد، وكافة الجهات الداعمة من المستشفيات والبنوك والمختبرات وشركات التأمين الصحي وشركات تكنولوجيا المعلومات. وشكر موصول لزملائنا في أعضاء اللجنة التوجيهية وأعضاء اللجنة الاستشارية لجهودهم التي بذلوها في سبيل إخراج هذا المؤتمر وبهذا الشكل في صياغة الأهداف والمحاور واختيار المتحدثين. ولا أنسى جهود فريق عمل مجلس اعتماد المؤسسات الصحية، فلولاهم وسهرهم الليل والنهار لإنجاز هذا المؤتمر لم نكن موجودين هذا اليوم. أجدد شكري لسموكم صاحبة السمو على وجودكم معنا في هذا المؤتمر، وهذا يحفزنا للمضي قدما في تقديم أفضل الخدمات الصحية لمرضانا الأردنيين والعرب والأجانب. ختاما أشكر لكم حسن استماعكم، متمنيا لكم مؤتمرا مفيدا يحقق الغايات التي شاركتم من أجلها، وأتمنى لضيوفنا طيب الإقامة في ربوع بلدنا الغالي، سائلين الله أن يحفظ بلدنا آمنا مطمئنا في ظل قائد البلاد جلالة الملك عبد الله الثاني بن الحسين المعظم. والسلام عليكم ورحمة الله وبركاته. And now it gives me a great pleasure and honor to introduce our keynote speaker, who is a well-known member of the House of Lords in the United Kingdom. And he co-chaired the all-party parliamentary group in global health. Also, he co-chaired the Nursing Now, the global nursing campaign. And he was previously the chief executive of the English National Health Service and the permanent secretary of the United Kingdom Department of Health, the largest health organization in the world, 1.3 million employees, where he had major reforms in that between the period of 2000 and 2006. He is a senior fellow at the Institute for Healthcare Improvement and an honorary professor at the London School of Hygiene and Tropical Medicine. And he is a foreign associate at the US National Academy of Medicine. With so many things to say about you, please welcome with me Lord Nigel Crisp.
Thank you very much indeed. Your Royal Highness, Princess Muna, Your Royal Highness, Prince Merid bin Raid, Your Excellencies, the Minister of Health, am I not speak? Is my microphone not on? No. Okay, I'm all right. I think, Your Excellencies, Your Excellency, the Chairman of the conference, ladies and gentlemen, what a great pleasure it is to be in your beautiful country. And can I say, I had a chance to go to Hcac yesterday, so I do know a bit about what I'm talking about. So great pleasure to be here, and congratulations to Salma and colleagues for this great conference. When I look at the conference program and who's speaking, I can see you've got a really wonderful program for these 2 or 3 days. Great topics and a great set of achievements. I didn't actually understand what she was saying, but I understood the slides, Salma. And I could see how much you have achieved in such a short period. May I also just pay tribute to Her Royal Highness Princess Muna for what she does globally. You will know what she does in Jordan, and we've seen that, I think, again on the slides, as a great advocate for health and health workers, and particularly nurses. But I work globally, and I have met Princess Muna on a number of occasions and seen what a great contribution she makes globally to health workers and nurses in particular, and I know they thank you for it. And can I also just say thank you for letting me speak in English? You know the old joke, don't you? That somebody who can speak 3 languages is trilingual, somebody who can speak 2 languages is bilingual, and what's somebody who can only speak 1 language? English. So I'm going to carry on in English. And I'm going to take you back to 2000, so a little bit in the past, to pick up some lessons from the past. I think I've probably got to get this onto the right thing. Past lessons, future directions. A few lessons from the past, but to 2000, because that's when I was running the NHS, but also that's also when we set out a lot of policies which since have been developed and moved forward, and I'm going to talk a bit about that and pull out some lessons from that, lessons that I think will reinforce a lot of what you are doing here, Salma, here in your great country. And then I want to pick up some of the challenges, the future directions, because the future isn't going to be like the past in a number of ways, and there's some big challenges coming down the line for all of us. So let me start off with 2000, when we had a new government, relatively new government, that came in and was absolutely determined to make big changes in the NHS. We'd been going downhill for a bit. And there were 4 or 5 key points here. The first one, a clear vision. They set out the NHS plan, a clear vision and leadership. And when I say leadership, I'm not actually referring to myself. I'm referring to the Minister of Health and to other leaders who are really making big changes. And in that plan, we set out targets and we set out standards. One of our big interests was access and speed of access. So, for example, in our emergency departments, we were worried about how long it took for somebody to be assessed and treated and so on. So there were targets about that. But there were also clinical targets about things like how soon people got clot-busting drugs after they'd had a heart attack, for example, to put it in very simple terms. So a whole range of targets and standards. Additional resources. The government gave us additional resources, which is wonderful. But it was all about quality everywhere and in all aspects, and that's the bit I'm going to talk about in terms of the lessons. But it was also, not immediately in 2000, but subsequently, we developed this public-private managed market, and this was a real change for the UK. This was the first point, and I say this to the chairman, with his background and his role, that it was the first time that we really welcomed the private sector into providing support for the public services. And that has been a developing theme over the last few years. But let me pick up quality and patient safety. And there are really 4 things that we did. Now, these are very particular to the UK, so I'm going to talk about them in fairly broad terms. But there were 4 things that were really very important to us. The first one was about quality improvement. It was actually about how do you improve quality. And we set up an agency called the Modernisation Agency, which was the place where they developed best practice guidelines, best practice methods, and so on. I always said that as a chief executive, I had 2 hands. With one hand, I held people to account. People were accountable for delivering the targets and the standards. But with the other hand, we were also trying to help them to do that, because it's not always obvious how you make improvements. Sometimes it sounds like a simple thing to do, doesn't it, making improvements? But one of the things I learned from the Modernisation Agency is there are real skills involved in quality improvement, in how you go about it. And I know that these are things that you do in this country with your approach to PDSA learning, to breakthrough collaboratives. And you've done what we're doing as well, which is we closed down the Modernisation Agency and put the people there into the institutions themselves. So you had the quality improvement, trying to build it into the institutions. Really important set of things. But the key message for me from all of that is quality improvement isn't just something that, clever amateurs can do, that we can all do, that there are skills and important ways and techniques for doing it that are effective. The second thing we did, we don't do accreditation in the same way as you do, but we have what we created then was the Healthcare Commission for inspection, monitoring and regulation. And it did much of what you are doing in terms of looking at all the organizations within the NHS, producing annual reports on them about where they could do better. But I want to draw out two particular points. It moved on from being the Healthcare Commission to being the Care Quality Commission, and I'll explain why. And the two big important points I want to make here are firstly, that what it does is it does assess things in terms of multidisciplinary teams. So it looks as a service as a whole. It's about teamwork. It's about quality being a product of teamwork. Really important that we're not just looking at what the doctors do or the nurses do or other people do. It is about looking at the whole team within an institution. But the second thing, and why we became the Care Quality Commission, is that the accreditation is not just in health. It's not just the hospitals, it's not just primary care, it's also the care providers for older people. And we've got an aging population more so than you, and we have a lot of independent providers providing care for older people. And it looks at the whole system, and really important that it joins it up, because failures in one part knock on everywhere. So we take a really whole system approach. And I see that you've moved into primary care and obviously doing much the same. The third area I just wanted to pick up on was NICE, the National Institute for Clinical Excellence. This was very controversial when we set it up. It was started off by assessing therapies. It wasn't assessing therapies to see if they, and drugs in particular, to see if they were safe. It was actually making comparisons about their effectiveness between different drugs for the same condition. Now, the drug companies did not like this at all, as you can well imagine. And we made judgments about whether if the one drug was this effective and another drug was this effective, marginally better, but cost 3 times as much, what did we recommend that our clinicians should be using and why? So it was a really quite a contested but difficult area. But I would say, and I feel sympathy with the Minister of Health in terms of managing budgets here. Our budget at the time was £11 billion for drugs. That is 10 billion of your dollars, I think, if I've got that right. 1% down on that would, of course, make it, £100 million. If you reduced your expenditure, you saved $100 million, sorry, is what the language I'm using. Or if you overspent, it was $100 million. Really important that we got on top of the drugs and we understood that we weren't just going to buy the new one because somebody had developed the new one, but actually there were comparisons to make. But what NICE has gone on to do since then is to develop the guidelines and the evidence showing where things are effective and what categories of people are effective. So some quite tough things that were said and done then. And then finally, something which I don't know if you do, which is we tried to align our payment systems to quality. So that, and indeed you do, so that we made sure that, for example, people got paid, and one example I think of is a hip replacement. We had a standard which was a patient-reported outcome measure. So what did the patient think of the whole process, not just was it technically good, and that, if you got that right, if you got high scores on that, you got more money for your operation. So, there was a payment incentive system within it. So we were really trying to push quality. Now, I just want to show you one more slide before I start to talk about the future and the things we got wrong, because largely we got many of these things right. But I just want to show you one thing, which is this, which I'm not going to go into the detail of, but it's an important point that when we're talking about quality improvement across the NHS, we were talking the same language. Whether we were clinicians, doctors, nurses, physiotherapists, pharmacists, whether we were managers or indeed politicians, we tried to have the same methods and the same language. And again, I think you're doing that here so that people can understand how you make change happen. And we had a terribly simple 4-box method, which very roughly said, in the first place, be very clear about what it is. That's not a pointer. Be very clear about what it is, the clear actions for successful delivery. Make sure you know what you're doing, you're measuring it, you've made somebody accountable. Focus on the things that will deliver. This is the best practice. Make sure you know about best practice. The third box, make sure you're reporting. You've got performance management and accountability. And the fourth box, recognize that not everyone will be able to get this right. And you need to support the people who are having trouble. Now, our aim was always to say these are good people who are trying to make things happen well, and we always try and provide support. So we would support the highest risk organizations, because sometimes they were failing not for their own fault. In the end, of course, we sometimes had to deploy high-profile action teams and change the management or whatever. But that was our language. Now, I'm not suggesting for a moment you copy this, but my simple point about the lesson is that this depends on the culture and the time and the context that you're working in. But having something that is a common language about how you do it, so that it's not just a few individuals who are saying quality matters, it is the organization that has got quality built within it. Let me move on from there very briefly. Actually, the results were pretty good. Major targets were achieved. Public satisfaction almost doubled in a decade, from pretty low to pretty high, measured not by us, but by external people. And really importantly, the political context changed. In the UK, we've always had the sort of, broadly, the left of politics supporting a public health system, and we've broadly had the right of politics saying, not sure, maybe we should introduce private healthcare and become more like the Americans. This changed the argument. Now we've got both sides saying we're supporting the NHS and we are better at managing it than the other lot. Now that was probably the biggest achievement, actually, was changing the political context around the NHS. But let me move on from there, because the big issue was, you will have gathered from what I said, that a lot of what we did was pretty top-down. This was me and others driving a system to make change. But the big issue is sustainability. How do you get ownership everywhere? Well, partly it was using exemplars, partly it was training and development, and partly it was devolving power. So we gave much more authority to our hospitals, for example, and we allowed them to become semi-independent NHS trusts. So they were actually still belonged to the Crown, because public things belong to the Crown in the UK, and I suspect that may be true in the Kingdom of Jordan as well. But they had a great deal of authority at the local level as to what they did things. And we also introduced essentially an internal market and some competition to change the incentives. Now, this hasn't worked as well as we would want. This devolution from a top-down system, where you can do a lot with a top-down system, but you can't do everything, and you need ownership to make this work. And there were changes in policy and politics over the last few years that have made that rather difficult. So let me then move on from there to future directions, because actually the future is going to be quite different in a number of ways, and there are three big issues I've put on here. The first one, technology. I mean, it's the starting point, really. I'm not going to talk much about it, actually, because we could talk about technology and what that's going to do over the next few years, over the next 5, 10, 15, 20 years, because it is going to be extraordinary. And what's going to be extraordinary is there's going to be constant surprises about what works, but there's also going to be constant surprises about what doesn't work and what sounded like a great idea with technology. And I was told by a friend of mine from Thailand, he said, you know, digital health has got two meanings, and only one is about technology. The other is about digits, your fingers. It's about hands-on care. It's about technology, and it's about people. And I was in a great British hospital last week in Birmingham. Need ownership to make this work. And there were changes in policy and politics over the last few years that have made that rather difficult. So let me then move on from there to future directions, because actually the future is going to be quite different in a number of ways, and there are three big issues I've put on here. The first one, technology. I mean, it's the starting point, really. I'm not going to talk much about it, actually, because we could talk about technology and what that's going to do over the next few years, over the next 5, 10, 15, 20 years, because it is going to be extraordinary. And what's going to be extraordinary is there's going to be constant surprises about what works, but there's also going to be constant surprises about what doesn't work and what sounded like a great idea with technology. And I was told by a friend of mine from Thailand, he said, you know, digital health has got two meanings, and only one is about technology. The other is about digits, your fingers. It's about hands-on care. It's about technology, and it's about people. And I was in a great British hospital last week in Birmingham, I said this to the chief executive, and he said, yeah, and the chief executive is very keen on developing technology and is moving very fast. And he said, yeah, that's perfectly true, Nigel, but you know about the gloves, don't you? I said, no, I don't know about the gloves. And he said, there are these gloves which, somebody in a rural area, let's say a nurse somewhere, can be, palpating the abdomen of a patient wearing these gloves. And I can put on a pair of these gloves in Birmingham, 100 miles away, and I can feel exactly what the nurse who's doing that is feeling. Extraordinary thought that you can check out somebody like that at 100 miles away. Now, I guess it works, and I guess there need to be some trials about how effective that is going to be in the future. But it's just a wonderful example, isn't it, of how things are going to change. And the real issue here, I think, is the next two. It's really about staffing, because actually the people in the system can be an enormous barrier to those changes or an enormous accelerant. People need to change really very, very substantially if we're going to see the changes in service models that we've got. And we've got to break down some of the rigidities we've got. We've got to get better teamwork and much more fluidity and much more flexibility around that. And I think those people in the room who work in other industries will know that actually investment in human capital is one of the big themes for the future. Because we know with AI, artificial intelligence, changing the way things are happening in industries all over the world, all sorts of industries, that actually a lot of jobs are going to disappear. But the new jobs that are going to be created, according to the Governor of the Bank of England, will be in caring, they'll be in influencing, they'll be in persuading, they'll be in the things that human beings do. And actually this is part of a very, very big change that is going on globally, and it isn't just about health. And this is a really, really important opportunity for us to build the future and to think about that. And I'm going to say a bit more about that. And then the other area is health. Moving away from a focus exclusively on healthcare. Let's get good at treating diabetes, but let's stop making diabetics, to put it at its simplest way of thinking about it. But this isn't just about prevention. Prevention is really important. It's actually about health promotion. It's actually about creating and enabling people to be healthy. Health is more than just the absence of disease. And I'm going to say a little bit more about that. And we've got to get on to that agenda. Otherwise, we will be overwhelmed. And we're being overwhelmed in the UK, particularly by what everyone will know as long-term conditions, non-communicable diseases, and so on. So these seem to me to be the two big things. Now, they do relate very heavily to quality, and I think to accreditation as well. Now, I'm going to go down a slightly different route. Often when people talk about staffing in a health system, they start with the doctors. I'm going to talk about nurses. Her Royal Highness will be pleased to know, who are, after all, half the health workforce. Now, the examples I'm putting here are things that we did in the NHS or have done in the NHS. We've made some big changes. We've introduced what are called advanced nurse practitioners. These are people who are practitioners in their own right. They have their own scope of practice. They do a whole range of things, see upper scopes and see downer scopes and will order x-rays and do a whole range of things. We introduced nurse consultants and specialists in particular disciplines. We also enabled nurses and other professionals of the same level, people like pharmacists, to prescribe across a range of drugs, and only when they'd had additional training. That was very contested in 2003 when we brought it in, when I was chief exec. But what was interesting is I had one lot of doctors on my side and another lot of doctors against it. The lot of doctors on my side were, interestingly, people like palliative care physicians. They were saying, look, my nurse, my colleague nurse, understands as well as I do the plan for this patient and where we need to increase the opiates or whatever. Why does she have to wake me up in the middle of the night to write the script? We can do these sort of changes. And in 2003, this was quite contested, but I have to say we got the Minister of Health and the Prime Minister on our side, because sometimes you have to get the Prime Minister on your side as well to make sure the doctors don't all go and talk to the Prime Minister, if you see what I mean. We pushed that through after a lot of evidence as to what worked. So it wasn't casual, it took 2 years. Now it's not controversial. It's just part of how people do things. These are big changes, but they weren't far and fast enough They're not about the whole team or about the whole system. Because if you change what one person does, there's a knock-on effect on what other people do. And we didn't get fully into that. And I think that's where the future is. And I'm going to take a slight digression onto a great campaign that we are running, which I co-chair, which is called Nursing Now. And our goal is to improve health globally by raising the profile and status of nursing. And I'm delighted to say that Princess Muna is one of our great champions for Nursing Now, as indeed, may I say, is Her Royal Highness the Duchess of Cambridge in the UK. So we have great support for this campaign. And it is very much about saying, look, actually, we could enable nurses to do far more in the future. They're half the professional health workforce and could do a great deal more. Our strategy is to influence policymakers globally and to create a global movement. Well, we're starting to influence policymakers. On creating the global movement, we've got very little money, but in a year and a half, we now have 420 groups in 108 countries around the world, with Jordan very well represented, with Roeda Almeida on our board, and we know that you're very actively part of this, but this is a tremendous campaign, which actually shows me that this is a change that's time has come. People get this. They understand that actually the biggest part of the health workforce, if we enable them to work more effectively, then the whole team gains. It's not about doctors losing and nurses gaining. It's about the whole team gaining by strengthening what happens with nursing. And next year is going to be the year of the nurse and the midwife. The World Health Assembly has dictated that it will be or agreed to our request, actually, that it should be the year of the nurse and the midwife. Very conveniently, a woman called Florence Nightingale, who many people will have heard of, I suspect, is 200 next year. So we were able to tie it into her bicentenary, which is great. But that means that there's a great opportunity to really move this agenda on, because I think this is really very important, and I very much hope and know that you're going to be doing a lot here in Jordan. But the simple message here is about these things. Nursing for the future. What is it going to look like? As I say, we think that raising the status and raising the profile and allowing nurses to do more is one of the biggest things you can do to improve health globally. Nurse-led clinics, particularly for things like diabetes, and I can give you examples in the UK and in Tonga. Nurse-led primary care in the UK and in Kenya. Got a wonderful example in Kenya that links us back to technology. Midwives in Kenya in rural areas now have small ultrasounds which they can use and work with mothers-to-be, pregnant women, to check them out. They feed the results straight into a tablet, which goes straight to the referral centre. The team has shifted a bit. The patient hasn't had to move, but the team has shifted a bit. But there's a role here for the specialists back in the referral hospital. There's a role for the nurses, and there's the ability to get in early with people who simply aren't going to come 100 miles or 200 miles to an antenatal clinic. So you can really make change. Nurse-led promotion and prevention, again, UK and Sri Lanka, I can give you examples. All of this, of course, is difficult because it requires changes in legislation, regulation, education, and employment. But these are the sort of changes we need to see. And I've taken nurses as an example, but I could have, because they're the biggest, and because actually I'm advocating nursing, of course, but I could have done this with other professions. The changes, I think, are going to be profound. As this technology comes in, as the gloves take hold, or whatever, we're going to see such profound changes. So let me finish then by just picking up this focus on health. This means, I believe, a very big focus is going to be needed on community and home-based primary care and on what I think of as prevention and treatment at the same time. We all know that people with long-term conditions, actually how you're working with people and older people is both about preventing acute episodes or whatever, but treating as well. These things go hand in hand. And I was given a great example by one of your leading doctors yesterday evening about work that's being done here on the prevention and promotion agenda, which I believe is going to be written up, which is doctors and nurses working together with patients, encouraging them to change their lifestyle. But that only goes so far. That's when people have acknowledged their patients or where they've got a problem, What about schools? What about employment? What about all the places which actually affect our health? Most of the big health problems in the UK are now things that can't be affected by the NHS itself alone. They're about what happens to people at work. They're about stress induced at work. They're about what's happening to children at school and how children at school can learn and develop. They're about loneliness, great sadness. Being lonely, two things. Being lonely is gives you a 15% higher chance of mortality than if you're not lonely. But actually, when loneliness becomes social isolation, it's a precursor of dementia. You know, these are really serious issues. The NHS can't do anything about that. It's about these other people. And I wonder at what point the great accreditation bodies of the world are going to accredit healthy schools, health-creating schools and health-creating employers as well. Employers that do more for their people's health than for others. And I know I'm sure there are examples in this country of both of those. And of course one needs legislation on food safety and health, but bearing in mind always that the health of the country's people is the primary asset. And that will become even clearer in the future. In the world of the future, where actually jobs are going to be different, the health of the people and their health, not just the absence of disease, their health and their ability to do things will be so fundamentally important. So let me finish on another note, which is why it's always a wonderful pleasure and privilege to visit other countries and to talk to people and to learn from what you're doing. Because in the words of the IHI, the Institute for Healthcare Improvement, who's influenced so much of your agenda and ours, I think this is a great statement. Working together, everyone's got something to teach and everyone's got something to learn. And I look forward to hearing about what's happening in Jordan on nursing, of course, but more than that, on what we can learn from what you're doing and how we can share the lessons of the past, but share them in this very challenging future, where I think I've just tried to illustrate just some of the issues that, and I think particularly of the younger people in this room, what you're going to be dealing with in your professional career and how it's going to change over the next 20 or 30 years will be astonishing. Thank you very much indeed.
Lord Crisp, I do not think we could have gotten off to a better start. Thank you for so much inspiration, reality, and future thoughts. بعد هذا الحديث الملهم وبعد السماع عن ال HCAC والمؤتمر، أود أن أتوقف لحظة لتذكيرنا جميعاً لماذا نفعل ما نفعله. واحدة من أكبر أسباب الوفاة في العالم، ومعظم هذه الأخطاء يمكن تجنبها بوضع الأنظمة وتطوير السياسات وتدريب الكوادر. فأدعوكم لتشاهدوا معي هذا الوثائقي القصير كي لا ننسى.
Cal suffered brain damage from his newborn jaundice when it was misdiagnosed. Today he has significant cerebral palsy. And Pat, my husband, died when he was 45 from a cancer that was appropriately diagnosed, but the pathology failed to get communicated to the doctor or Pat. It was hard for us to understand and believe that this could happen in a developed country like the United States.
We look at many of the statistics as the third leading cause of death in the U.S. Most people are completely unaware of that.
That is the equivalent of 7 or 8 airliners crashing every day with no survivors.
We're probably filling one Arlington cemetery every year from preventable medical harm.
Most of us in medicine just said, well, that's the way it is.
This is a problem that's, hiding in plain sight.
It's urgent. It's a public health emergency.
If you believe first do no harm, there is no excuse for not investing in things which will prevent harm.
We have to acknowledge that to err is human, and then to figure out what do we do with that fact in terms of building a system that's safe for patients.
We got to change it. We got to make it better, and I think many people are working very hard to make it better.
One of the ways to really make a difference is you've got to get patients engaged.
We could prevent many, many, many of these deaths immediately if we just put in the effort.
We need to think about them not as unavoidable, but as unthinkable.
To change patient safety, you have to change everything.
We built it completely wrong. This is a time for openness and honesty. It's not any longer a question of possibility, it's a question of will.
These are not just things that happen to other people. They happen to us, they happen to our families, and they are things that we need to work on.
I cannot change what happened to Cal and Pat. However, my family's story is also a story of awakening, of passion, of change, and hope for the future.
These are things that happen to us. نعم، هذه الأخطاء ليست مجرد أحداث تحدث لأشخاص آخرين، بل تحدث لنا ولأحبائنا وعائلاتنا. فلنضع سلامة المريض دائماً نصب أعيننا، لنضع سلامة المريض أولوية المرحلة، ولنضعها المحرك الرئيسي للتطوير. يا صاحبة السمو، لقد كنتم دائماً الداعم الأول لمجلس اعتماد المؤسسات الصحية منذ نشأته، وآمنتم برسالتنا وبالدور الذي نلعبه. ومن هنا وبالنيابة عن جميع القائمين على المجلس من مجلس إدارة وفريق عمل ومستشارين ومقيمين وشركاء، نشكركم ونشكر دعم سيدنا قائدنا وقدوتنا جلالة الملك عبد الله الثاني بن الحسين المعظم حفظه الله ورعاه. ونجدد اليوم تعهدنا بمواصلة العمل لتحسين جودة خدمات الرعاية الصحية بالشراكة معكم والحفاظ على حقوق المريض وسلامته تلبية لتوجيهات سيدنا ومن أجل أحبابنا وعائلاتنا. وبهذا أدعو سموكم وعطوفة الدكتور فوزي الحموري لتقديم درع شكر وامتنان لمتحدثنا الرئيسي. Please, if you can join us on the stage, we would like to Lord Nigel Crisp, we would like to thank you for being with us, sharing your expertise and thoughts for the effort you have put. Would you kindly please come to stage to receive a small gift as a token of appreciation? I am in. Your Royal Highness, we also have a gift of gratitude for His Majesty King Abdullah in gratitude for his support to the Healthcare Accreditation Council. نتقدم بجزيل الشكر والامتنان إلى صاحب الجلالة الهاشمية الملك عبد الله الثاني بن الحسين المعظم لرعايته هذا المؤتمر ودعمه وتحفيزه المتواصل للنهوض بجودة القطاع الصحي. وفي الختام نشكر الحضور والضيوف ونرجو من الجميع البقاء في أماكنهم مشكورين لحين مغادرة صاحبة السمو الملكي الأميرة منى الحسين، ومن ثم ندعوكم لاستراحة وزيارة المعرض. والسلام عليكم ورحمة الله وبركاته.